And as mentioned by Dr. Silva, YBKJ, your presence speaks volumes about your commitment in addressing the issue of stunting among Malaysian children. And now, it is with my greatest pleasure to invite Yang Muhammad Khairy Jamaluddin, Minister of Health Malaysia, to deliver the welcoming speech and officiate the event.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh dan salam keluarga Malaysia, sehat sejahtera. Terima kasih saudara pengacara majlis yang bahagia, Dr. Silva Kumar, Presiden Persatuan Pediatrik Malaysia, Profesor Dr. Lee Wesia, Chairman of the IMFeD for Growth Program, Professor Datuk Dr. Zulkifli Ismail, Secretary General of the Asia Pacific Pediatric Association, ladies and gentlemen. Pertamanya saya merakamkan ucapan terima kasih kepada Persatuan Pediatrik Malaysia atas jemputan untuk saya hadir pada hari ini untuk sama-sama kita meraihkan ulang tahun yang ke-10 IMFeD ataupun program IMFeD for Growth yang dilaksanakan oleh Persatuan Pediatrik Malaysia bersama dengan Abbott. Ini adalah satu program yang sangat-sangat bermakna dan penting kerana membantu memberi pemakanan yang berkhasiat dan yang sihat kepada kanak-kanak di Malaysia. Masalah mal pemakanan di Malaysia, sama ada masalah bantut, masalah obesiti ataupun masalah-masalah kesihatan yang lain yang terhasil daripada mal pemakanan adalah satu perkara yang sangat serius di Malaysia. Malaysia adalah negara berpendapatan sederhana tinggi, tetapi kita berdepan dengan masalah mal pemakanan, terutamanya masalah kebantutan di kalangan kanak-kanak kita. Sebagai negara yang berpendapatan sederhana tinggi, kita sepatutnya tidak ada kanak-kanak yang lapar ataupun yang diberikan makanan yang tidak berkhasiat. Sepatutnya kita mempunyai keupayaan dan juga kemampuan untuk memberi kanak-kanak kita makanan yang berkhasiat, yang bernutrisi, supaya mereka mencapai potensi masing-masing. Ini adalah tragedi yang sangat-sangat besar yang perlu kita atasi dengan kadar segera kerana kita tidak boleh tunggu lagi sehingga kita melihat kanak-kanak kita tidak memenuhi potensi mereka. First and foremost, I would like to thank the Malaysian Pediatric Association for inviting me here today. It's actually quite a busy morning for me. I asked for the function to be brought forward slightly because I have to table amendments to the Poison Act in Parliament this morning. And yesterday, I was supposed to table it yesterday, and the debate on other issues dragged on, so my bill was postponed till today. My office told me that they wanted to send a representative here this morning. I said, no, I'd like to come myself, even if we can squeeze it, because this is a very important issue for me. And now as Health Minister, I get to do something about it. And what is important to me is that every child, especially here in Malaysia, must be able to realize their full potential. That is the guiding principle. That is the true north as far as I'm concerned. Especially if the barriers and obstacles to that child achieving his or her potential is something that is avoidable. And to me, malnutrition is avoidable. We have the ability, the tools, and even the means in place to ensure that children in Malaysia are able to access nutritious foods, that we can intervene if they cannot, and that we can do something about it. And that's why I wanted to congratulate everyone involved in the IMFeD program, from the Malaysian Pediatric Association, from Abbott, because this, I mean, you've been doing this for 10 years. And that's a good length of time. But we need to do more, and we need to scale it up so that this is a whole of society effort, so that we can combat malnutrition, especially among children. As you know, and as Dr. Selva Kumar mentioned earlier, we've launched a national strategic plan to combat malnutrition from this year until 2030. This has 4 phases, 5 key strategies. 1, consolidation of dietary well-being administration through legislation, political commitment, and greater involvement of stakeholders. As stewards of children, of course, we need to step in. Sometimes we need to step in with regulations and legislation when it's too easy for them to be targeted by people who want to sell them foods that are not healthy. Secondly, better quality and access to healthcare to combat malnutrition. And this is where we need to work together with the Pediatric Association, with parents, parent advocates, to make sure that parents continuously monitor and keep data of their children's growth. Third, creating a more conducive environment for children's well-being. This is in totality of how we look after and make sure that they are safe and that they grow up in a safe environment that will allow them to fulfill their potential. Fourth, empowering individuals to encourage the well-being of children. And 5, of course, the dietary health of children. And when it comes to the dietary health of children, of course, it's easy for us as policymakers to say, please make sure your children eat healthy meals. But for some parents, this is not even a choice. For some parents, they cannot afford it. For some parents, healthy meals for their children is just something that they cannot afford on a daily basis. It is easier, it's more convenient, it's cheaper, unfortunately for them, to keep their children away from hunger by feeding processed food, fast foods, and unhealthy foods. So that's why I said it has to be a whole of society approach, a structural change in how we look at nutritional security, not just food security, but nutritional security for our people, especially our children. I cannot lecture people to eat their vegetables and fruits when vegetables and fruits are expensive. We need to bring the price down. We need to work with local farmers, and maybe this global supply chain crisis and inflationary environment is a blessing in disguise, is a wake-up call for us to invest in more things that matter in the future, more security that matter in the future, which is food and nutrition. So we want to look at this not just in terms of health intervention, but in terms of socioeconomic interventions as well, to reduce the barrier and obstacles for people to live healthier lives and for them to give their children healthier outcomes. I want to table the strategic plan to Cabinet soon so that we can get some commitment in the upcoming budget for 2023 so that we can intervene better in some of these outcomes. Last month, I also launched the Special Cabinet Committee to combat the double burden of malnutrition among children in Malaysia with our hashtag Anak Malaysia Sehat program, or Healthy Malaysian Child program. Of course, this is about awareness. It's a media program so that there are more resources out there for parents to understand the outcomes that you want, the targets that you need to meet, and the interventions that are available. We are giving a lot of focus first also on the first 1,000 days of a child's life, from conception, of course, to their second birthday. Pediatricians, of course, have advised me that this is one of the most significant time for mental and physical development of a child. And again, we want to make sure that there are enough incentives and support for mothers who don't have support for them to be able to look after their children until they are born, until their second birthday, and thereafter. Some of the ideas that we are thinking about is if, for instance, we expand cash transfer programs, we introduce new cash transfer programs for mothers, and we give it to women, not to the fathers, not to the husbands, but we give it to the mothers for the first 1,000 days, because mothers will know what to spend on. We don't have to tell them what to spend on. So we're looking at various strategies, amongst others, as I mentioned earlier, for instance, cash transfers to mothers, better school feeding program. I think evidence has shown that school feeding is effective. School feeding is effective not just in satiating our students' hunger, but also in improving educational outcomes so that they are nutritious, well-fed, have access to food, and they can focus on their studies. The other thing that we want to look at, of course, is the access to healthcare, and to make sure that we can encourage parents to continue to come to clinics for monitoring the growth of their children. This is a vital service, of course, that we provide. The Ministry of Health does this for children below 1 year old, 80% of whom attend the well child visits at our government health clinics. But my concern is the attendance rate declines to about 40 to 50% amongst 1 to 4 year old, and it goes down to 20% amongst those who are 5 to 6 year old. And that's where we need to work together. MOH, together with the Pediatric Association, all the doctors who look after children, to fill this gap and to make sure that we can continue to encourage them to come. And let's make it easy also. You know, I've tried to study the determinants of why people drop off from attending clinics. And you would think that attending clinic is something that is easy to do, but it isn't. You have to take time off work. And you have to remember that young parents, especially young mothers, if they're going back to the workforce, they have to take time off. Some employers don't give them paid leave, and it's difficult. For those who rely on a daily wage, that's 1 day's wage gone. So we need to introduce incentives to protect mothers and fathers in bringing their children for their routine checks at the clinics. We also have to make sure that we can continue to monitor outside of the clinic setting. And this is something that, again, I want to work together with the Pediatric Association and also preschool education settings. The feedback that I got from kindergarten providers in government, as well as the Ministry of Education, in some schools they just don't have the measuring tools anymore. They don't work. So I'm going to fight for some allocation in this year's budget so that we can get funding for preschools and schools to have their own measurement tools, so that basic things like just tracking weight and height and meeting the milestones can be done at the school setting. The other one is data. And this is something, of course, I'm big on as former Minister for Science and Technology, huge on digitalization. Of course, not everyone has it, but many people do have smartphones and access to applications. One thing that I've done is to try to pivot MySejahtera from being the check-in COVID app now to a public health app. So what we've done is we've launched the new updated version. So all your NIP records now can be kept on MySejahtera. You don't have to, look for your children's immunization records anymore. Many of us misplace it over time. So now it's just all in MySejahtera, together with your COVID vaccination records. Easy. And if you don't like MySejahtera, you don't have to use it. You can still use manual. You can still, I'm not forcing you. It's just there to make it easy. And another update that we're working on is, of course, digitalizing the Pink Book. So the Pink Book will be fully digitalized in MySejahtera as well. And you don't have to carry the Pink Book around anymore. And that kind of data is helpful not just for parents, but for medical practitioners as well. You can just access it quickly. all the electronic health records hopefully will be there. And we will spend a lot on making sure that your data is protected and the system is protected, because that's a big concern for all of you. I'd like to applaud the Malaysian Pediatric Association for complementing all the efforts that have been done by MOH by conducting the IMFeD for Growth annual screening program. Since 2018, I think you've done, your partners have done, and your members have done 100,000 growth checks. I think, big round of applause to the Malaysian Pediatric Association. Thank you. And parents, please come forward to take advantage of the screening campaigns, take advantage of the interventions that are being promoted by IMFeD, the programs that have been done. And it is for this reason that this program should continue, and I will continue to support through MOH the program success, where we can detect any growth faltering as early as possible so that we can intervene. The first sign of faltering, there must be intervention, because ultimately we want to make sure that kids fulfill their potential. I'm committed to ensuring that we can put an end to malnutrition in children. I personally will fight to ensure that as many tools as possible will be at our disposal. I'll invite the Malaysian Pediatric Association to be co-opted into the Cabinet Committee to fight malnutrition amongst children. I think that we should also stress on screening adolescents as well. This is another value add to the campaign, given that this is the final opportunity to correct growth faltering. So on this note, I urge parents across Malaysia to take their children and adolescents for much needed growth checks in this upcoming screening campaign that we're having between August and October. Finally, another initiative that I just wanted to share with you. Over the weekend, and this is about really not leaving even one child behind. It's easier for people in the urban areas, but it's tougher for people in the rural areas. Awareness, access, intervention, tools, hard to come by. Over the weekend, I launched the first ever Orang Asli Health Survey by MOH. We used to do National Health and Mobility Survey. Every couple of years we do it. But we realized that the data from the National Health and Mobility Survey only encompass very, very little sample from the Orang Asli community. And the last data points that we have from 2011 showed that 64% of Orang Asli children under 5 were malnourished. And that's a great disparity compared to the national average of about 21%. And of course, this is unacceptable. It doesn't matter where you are. You can be in the deepest reaches in the interior, but you still deserve access to nutritious food and health intervention that can make you fulfill their potential. So hopefully with that survey that we're running now over 3 months, we will have better data on how we can intervene, especially with marginalized communities like the Orang Asli, to make sure that no child is left behind. Finally, I'd like to thank the Malaysian Pediatric Association. Some of your members have come forward very strongly to support a bill that I will be tabling to Parliament on the 1st of August. This is perhaps one of the most consequential bills that the Ministry of Health will table in Parliament, which is we will put a generational end to smoking in Malaysia, once and for all. Many counter-arguments and talking points that have emerged over the last few days, no doubt sponsored by Big Tobacco. I ain't having any of it. This is it. Why would you want them to start smoking in the first place? Whether it's cigarettes, whether it's e-cigarettes, whether it's vape, there is no harm reduction when they haven't started smoking in the first place. So I know illicit market is a problem, enforcement will be a challenge, But if it becomes a social norm, that if you are born after a certain date, you do not have the right to buy, purchase, possess cigarettes or any smoking product, I believe that we will bring about an end game to cigarette and smoking here in Malaysia. So please continue the support, because it's going to be tabled in Parliament on the 1st of August. I know the big tobacco talking points are circulating among MPs, and the debate will no doubt be robust. I'll do my best, because we owe it to the children of Malaysia not to deny them of their rights, but to make sure that we take away from them forever something that we know now from the science has absolutely no positive value at all. We close the door shut once and for all. So thank you very much, ladies and gentlemen. Congratulations on the 10th anniversary of IMFeD, and all the best. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, YBKJ. I'd like to kindly invite YBKJ to remain on stage. And ladies and gentlemen, just before we proceed to the launch, I want to take this opportunity to actually give a round of applause to YBKJ and the efforts of the Ministry of Health Malaysia, all the initiatives that have been mentioned by YBKJ earlier. Can we give a big round of applause to that? And now, we shall proceed with the launch. I would like to invite on stage Dr. Silva, Professor Lee, and Dr. Zulkifli to join YBKJ on stage for the launch itself. And members of the media, you may be present right in front of the stage. So YBKJ as well as Dr. Silva, we have placing the placements right there. Perfect. So, there'll be buttons that are going to appear on screen, so we'll be pressing the buttons on my count. Oh, wait. We'll do a countdown for that. So, ladies and gentlemen, I hope that you are ready. YBKJ, are you ready? Dr. Silva, are you ready? With that being said, we're going to do a 5 seconds countdown for the launch. In 5, 4, 3, 2, 1. And with that, ladies and gentlemen, happy 10th anniversary to IMFeD for Growth program. We've just introduced the logo for all of us to capture at this moment. So, to YBKJ, and of course the doctors and professor, we're going to take a quick photo right here. First at the center, and now to your left, and lastly to your right. And we're going to have one more biggest thumbs up for this in 3, 2, 1. Once again, ladies and gentlemen, let's give a huge round of applause. And YBKJ, as well as our distinguished guests, I would like to invite you to have a seat first for a very special preview they're about to showcase after this.